What is osteogenesis imperfecta? Also known as OI, brittle bones, or Vrolic syndrome, this is a genetic disorder/recessive mutation with the characterization of bones that break easily for little or no reason at all. An affected person may have as many as a few hundred fractures in a lifetime. It's extremely rare. Roughly 20,000 to 50,000 people in the U.S. suffer from brittle bones. Osteogenesis imperfecta occurs when someone has either too little or poor quality of the type 1 collagen. This is due to a genetic mutation on the collagen. There are 8 types of osteogenesis imperfecta. But to save us all some time and boredom, we're just going to show you the 2 extremes, classifications type 1 and type 2. The other 6 types fall somewhere in between. Type 1 is the most common and mildest type of brittle bones. In type 1, the collagen structure is normal, but the amount of the collagen is lower than usual. Some of the symptoms are brittle teeth, possibly hearing loss, loose joints, muscle weakness, or a tendency to spinal curvature. Type 2 is the most severe type of Vrolic syndrome, due to the type 1 collagen being improperly formed. Type 2 is lethal shortly after birth, often due to underdeveloped lungs. Victims will suffer from numerous fractures and severe bone deformity. Only 10 to 15% of OI cases are recessive. If a parent has a recessive form of OI, there is a 100% chance their children will be carriers for the recessive gene. Despite this, most of the cases are a dominant defect, meaning only one copy of the mutated gene is necessary for the child to have OI. Children who have the dominant form have either received it genetically or had a spontaneous mutation.
Osteogenesis imperfecta was first mentioned by William Vrolic, an anatomy professor at the University of Amsterdam, in the Handbook of Pathological Anatomy written roughly around 1842. The only forms of prenatal testing is through an ultrasound or cell analyzation to check for the genetic mutation. Even with experience, it's difficult to identify the type before birth. After birth, diagnosing OI is a difficult and often inconclusive process. Through a collagen analysis obtained through a skin or blood sample, a confirmation for OI can be found. There's not yet a cure for osteogenesis imperfecta. Rather, the treatment is directed towards preventing and/or controlling symptoms, as well as aiding in development of bone mass and muscle strength. Some recommendations for victims of OI are extensive surgical and dental procedures, care of fractures, physical therapy, and some form of exercising. There are searches for medications and treatments that are being explored to possibly treat OI, including growth hormones and gene therapies. So what else is being done for osteogenesis imperfecta? Scientific meetings held at the New York Hospital for Special Surgery have resulted in not only millions of dollars given for research, but expansion on trials and participants, with the most recent meeting covering new clinical treatment data for the first time. Respiratory failure and accidental trauma are the 2 major causes of death in people who suffer from OI, but the prognosis depends on the person, how many symptoms they have, and the severity of said symptoms. Despite the restrictions on physical activity and short stature, most people with OI lead normal and successful lives. Thanks for watching!